Tucson's Veterans Hospital, at the corner of Veterans Boulevard and Marine Corps Trail, has been a haven for generations of patients, but it hasn't always been a friendly place for those with gender struggles. Transgender veterans, those who were born male but identify as female or vice versa, have had to battle discrimination not just from family members or employers, but from a healthcare system that didn't take them seriously. But a sea change in attitudes is underway at the Southern Arizona VA healthcare system, where a new clinic serving these veterans is scheduled to open this week. Dr. Sonia Perez Padilla is leading a team that will provide specialized care such as hormone therapy, mental health services, and pre- and post-operative care for those who undergo gender reassignment surgery, although the VA doesn't pay for the surgery itself. It's been a long journey to get to this point, the doctor says.
I hit roadblocks with prescribing. The patients hit many roadblocks with discrimination. It was not an open time. But in 2011, VHA, which is Veterans Health Administration, published a directive that now not just supported but mandated that every VA would provide comprehensive care to all transgender and intersex veterans.
The military tends to be a magnet for transgender people, particularly those who were born male but identify as female. Many try to quiet their inner conflict by getting into macho military occupations, says Nadine Cole, a clinical psychologist who's part of the team.
Because the rates of suicide are considerably higher in the transgender population, 20 times higher. And so some of the research has indeed shown that veterans that are transgender are attracted to jobs in the military that put them at risk for trauma as well. So they may be in specialty SEAL teams, those kind of things.
While public acceptance is improving, there are still some who believe wrongly that the condition is a choice.
You don't have to be a professional to know that as human beings, we begin to identify with our respective genders at a very young age. 2 years old, 3 tops. Little girls know they're little girls, little boys know they're little boys. Well, there's no difference for our trans veterans. They, at 2 years old, know what they are and who they are, and unfortunately, it doesn't match with their biological organs. They don't have a choice. This is innate.